Outstanding result. Thank you so much. If we keep this rate going, we will hit all our targets in relation to vaccination. We're now at 5.6 million jabs in New South Wales, and 54% of us have had at least one dose, and 29% of our population is now fully vaccinated. These are great milestones that we're hitting, and we can't say enough how important it is for people to come forward and get vaccinated. Yesterday in New South Wales, we had 642 cases of community transmission, at least 41 of those, and this number will go up as we further finalise the cases. At least 41 were infectious in the community during this time. Sadly, 4 people lost their lives, and we extend our deepest condolences to their loved ones. A female in her 80s at Royal North Shore Hospital who was unvaccinated, a female in her 80s at Campbelltown Hospital who'd had 1 dose of vaccine, a man in his 80s in Nepean Hospital who'd had 1 dose of vaccine, a man in his 70s at St George Hospital who'd also had 1 dose of vaccine, and Dr Chant will provide further details. Again, our deepest condolences and sympathies to the loved ones of those four people. The areas of concern remain the same. The vast majority of our cases, an overwhelming number of them in New South Wales, are in southwest and western Sydney, and in particular we call out again Marylands, Greenacre, Guildford, Granville, Yagoona and Auburn. Please know in these communities the viral load is extremely high, and chances are you have the virus or someone you're coming into contact with has the virus. Please remember that. Also in Western New South Wales, Dubbo remains a concern and surrounds, and the Deputy Premier will give an update on regional New South Wales as well. It's so important to note that New South Wales has said all along, Delta is something we haven't seen before in our country, and we need to make sure we do everything we can to reduce case numbers, but also, of course, that we increase our vaccination rates. And it is through higher vaccination rates that we can look forward to living life more freely. And having said that, I also want to thank in particular the vast majority of people across the state, especially in those 12 local government areas of concern, that are doing their best. We know how stressful and difficult this is, and so many people are doing their best, but unfortunately the case numbers continue to grow in those same communities. In the last 48 hours, Health, Police and a New South Wales working group, given the compliance challenges that police have updated us on in the last few days, and given the surge in case numbers in the last few days, the government is now about to announce final measures to make sure we do everything we can. We throw everything at getting the case numbers down, but also while we do that, we put all our energies in getting the vaccination rates up. And I can't thank our citizens enough, because our aim is always keeping people out of hospital, keeping people alive and well, and that is the measure of success. So from Monday at midnight, the Greater Sydney lockdown will extend until the end of September. So the Greater Sydney lockdown will be extended until the end of September, but I also want to state that the Central Coast and Shellharbour will be defined as regional. So Greater Sydney includes all those areas that are currently in lockdown in Greater Sydney, but for the Central Coast and Shellharbour, which will be defined as rural and regional. And as we announced yesterday, for rural and regional communities, the lockdown is going until at least August 28, and we'll wait for health advice before we say anything more about that at this stage. I also want to stress that from Monday midnight, unless you're exercising, masks should be worn outdoors everywhere across New South Wales. Our concern is that when people are walking past a group of people or accidentally bumping into people, that fleeting contact can cause transmission. And even when you're exercising, you need to have the mask with you. In case you're doing some strenuous exercise and you happen to come into contact with anybody else, the mask needs to be put on your face. And this also, from police, makes it easier for them to make sure that everybody is sticking to the rules. So this mask wearing outdoors, unless you're exercising, applies to every single citizen across New South Wales. Whether you live in Sydney, whether you live in the bush, everybody has to respect that rule. We're also encouraging, as we do for schools, unless you absolutely have to, please do not send your children to childcare or to early childhood. We know this is a big imposition for many families, but as Dr Chant has been highlighting, we're seeing too much transmission from workers to families, and we need that to stop. So we understand that some families don't have a choice, and we get that. But we're just appealing to everybody. For schools, for example, it's only around 1 to 3% of students on a good day who are actually at school, and we want to see those percentages in childcare and early childhood as well, and that's for everybody across the state. We appreciate there are circumstances when that's not that possible, but we just ask everybody to do that as much as possible. Now, in terms of the local government areas of concern, I can't stress enough that we feel for you. We've imposed a lot of restrictions on you already. But we don't want to see more of you end up in hospital. We don't want to see more of you lose loved ones. And it's heartbreaking when you see disease rip through families. Families who are unvaccinated are suffering the most. And for this reason, the government has taken the advice of our health and police who've worked together on presenting these to us yesterday, that we will be implementing curfews in those local government areas of concern from Monday. From 9 p.m. to 5 a.m, you cannot leave your home, unless, of course, it's for authorised work or for emergencies. So police will be stopping everybody who's leaving their home from 9 p.m. to 5 a.m. And again, this is based on police feedback we received in the last few days about the type of activity that's unfortunately being carried out by a small number of people. But as we said, Delta doesn't leave any room for error. And I apologise deeply to the vast majority of people in those communities who are so doing the right thing. But for our own health and safety moving forward, we need to make these difficult decisions. If you are in a local government area of concern, we ask that you limit your exercise to an hour a day. Unfortunately, too many people are using that for the wrong reasons. Again, we want everybody to be healthy and we want everybody to utilise that exercise allowance in those areas of concern, but we ask you to limit it to an hour a day. Again, police have given us feedback that a handful of people are unfortunately doing the wrong thing where that's concerned. Also in those areas of concern, outside of school, if there's any professional development or education or learning, all of that has to be done online. We don't want people turning up for professional development or learning or anything outside of school, so make sure that any learning activity outside of school is conducted online. We're expanding click and collect in relation to places like garden centres, plant nurseries, office supplies. So anything that is an essential, we're asking everybody in those areas of concern to use click and collect services. And also, we're asking for vaccines to be mandated for childcare workers and disability support workers. It's really important to make sure that in relation to those workers that they're vaccinated, and they have until August the 30th to get their first dose to go back to work. I also want to mention that Commissioner Fuller has been given additional powers, which he will talk about in relation to police powers in maintaining compliance, and he'll also discuss the permit system, and Dr. Chant will provide an update on surveillance testing in those communities as well as rapid antigen testing. I also want to stress finally that in New South Wales there's 500,000 supply of Pfizer available to everybody 16 to 39 in those 12 local government areas of concern. You are being given priority. Please take up this opportunity, because the more we vaccinate, the quicker we vaccinate, the sooner we get out of this. And to all those 16 to 39-year-olds, the reason why we're extending the lockdown for another month and the reason why we're imposing these additional measures in those local government areas of concern is because the vaccine takes at least 2 to 3 weeks, the first dose, to have effect. So we're doing everything we can. We've thrown everything at this. And now it's time to bunker down. And I can't stress that enough. It is time for all of us to bunker down, take this as seriously as we can, although so many of us have, the vast majority have. This is it. We do everything we can to reduce case numbers, and we do everything we can to get those vaccination rates up. And yes, we will have 2 things to announce next week. Our plan for what schools looks like in term 3 and 4, and also what life looks like for some at 6 million jabs. And they're things we'll discuss next week. But in the interim, this is what life will look like for most of us until the end of September. But next week, can I stress, in relation to schools and in relation to what happens for fully vaccinated people at 6 million jabs, we will discuss next week, and their announcements will make next week. I'll now ask Commissioner Fuller to make his comments, then Dr. Chant, then the Deputy Premier. And please know, we will answer all your questions. So if everyone could just ask their questions one at a time so we can get to everybody. Thank you.